test, test, test. Testing, testing. All right, let me grab the multimedia team.
Testing, testing. You know what? Testing, testing. No? Test, test. Test, testing.
Testing, testing, 1, 2, 3. Testing, testing, 1, 2, 3.
Testing, testing. One more time. What?
Ready? Ready? Okay, so Betty sits down. We ready to go? Yes. Yes. Let's do it. All right. Well, good afternoon. Today is Thursday, August 7th, and let's call this special meeting to order. And I would please ask Rhonda, our clerk, to call the roll.
Supervisor Abakoga,
Here.
Supervisor Jung,
Here.
Supervisor Ellenberg,
I'm here.
Vice President Arenas,
Here.
President Lee,
Good afternoon, present.
and you have a quorum.
Thank you very much, Rhonda. So, for the audience, if you're in the chambers and require the Spanish or Vietnamese translation, instantaneous translation devices are available at the back of the chambers. The clerk can assist you with the setup. Translation is also available on Zoom using the interpretation button. Additionally, as a gentle reminder for public comments, staff and those of us on the dais, please speak clearly and at the measured pace directly into the microphone to ensure accurate translation. Next is our Pledge of Allegiance, and may I ask Vice President Arenas to please lead us in the pledge.
Please stand if you're able. Ready, begin. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, moving on today for the special meeting. The only item on the agenda today are the recommendations relating to a sales tax measure to protect our local services. We will not be taking comments on non-agendized items today. So to get this rolling and started, to present these items is our County Executive, James Williams.
Thank you, President Lee. Good afternoon, members of the board, members of the public. Before the board this afternoon at today's special meeting is consideration of a number of actions that I want to put in context because it's obviously not a usual day for us to have a special meeting at all. And indeed, it's not been a usual summer for our nation and for our county organization and local community here in Santa Clara County. And one of the reasons, among many, that it's not been a normal summer or a normal time is that on July 4th of this year, Congress passed and President Trump signed into law H.R. 1, the federal reconciliation measure that in these chambers for many months we had been discussing as it meandered its way through each house of Congress. H.R. 1 presents an extraordinary threat to core safety net services across the United States, and a particularly acute threat to those services here in Santa Clara County, core services provided by this county organization. And before we move into the specific recommended actions that I've brought before this board and the rationale for those, it's important, I think, to really take just a minute to walk through what we are facing as a result of H.R. 1. I'm going to just share my screen. The fiscal impacts of H.R. 1 affect a variety of programs nationally and present an extraordinary challenge, like I said, to the county organization specifically. But let me just talk nationally for just 1 second before diving into what it means for our community here in Santa Clara County. At a national level, this bill that is now law presents an unprecedented $1 trillion cut to the federal Medicaid program. Medicaid is the major insurance program for about 1 in 5 Americans and nearly 1 in 2 children in the United States. And the significance of that impact across the country is going to be profound. But of course, will be hugely significant here in Santa Clara County in particular, and most obviously for the nearly 1 in 4 Santa Clara County residents who are on Medi-Cal, which is California's implementation of the federal Medicaid program. H.R. 1 does a number of other things as well nationally, ones that we'll spend a little less time on because they have less of a direct fiscal impact to the county organization, but are nonetheless deeply significant, including to SNAP, which is known here in California as CalFresh, the Federal Food Assistance Program. Those changes, for example, to SNAP, including new work rule requirements, have already taken effect. They took effect immediately with the passage of H.R. 1. There's a variety of other changes included in the bill, too, to programs like Covered California, which affects health insurance here in our community, to immigration enforcement funding, to energy credits, and of course, very substantial tax cuts, in particular for those who are most well-to-do nationally. But the impact on our county organization is significant and mainly arises in the context of the Medicaid-related reductions. These projections that you see on your screen begin with the current fiscal year that we are in, because there are impacts, even though many of the larger impacts come in subsequent years. There are immediate impacts on our county organization. And I want to just emphasize at the outset again, these are just looking at H.R. 1 related and associated state impacts on the county. They don't include any actions that the state may take to deal with its own separate budgetary challenges, nor do they include our own county's local challenges due to slowed roll growth or other local sources of revenue. Those are all in addition to what you see here. But looking just at the H.R. 1 related impacts, for the upcoming fiscal year, mainly in the form of healthcare related items, looking at over a $500 million revenue loss, growing to over $1 billion thereafter. Now, these are based on reasonable assumptions, looking at what the CBO has put out in scoring the impacts of H.R. 1 nationally to the Medicaid program, looking at what that translates to in how California has implemented the program, and looking at what that means for our own county health system in particular. And I'm going to just take a minute to focus to drill down a little further on the health component, just the healthcare piece of those impacts fiscally on the county organization, which fall into a whole variety of categories, several of which we've spoken about previously in these chambers as the bill was moving forward, and several of which were significantly worsened in the version of the bill that was approved by the Senate compared to what originally came out of the House of Representatives, and some impacts that uniquely and in particular affect hospital systems like ours that serve a disproportionate share of individuals on Medicaid or in California Medi-Cal. I'm going to talk about a few of those categories specifically. The largest, and this is what the CBO scored as the largest single element of that $1 trillion federal Medicaid reduction, is the imposition of work requirements associated in the Medicaid program. These will come into place next calendar year. Now, what does that actually represent from a human standpoint? It is literally a reflection at a national level and in California and in our own county of thousands of individuals who will lose health insurance coverage. That is the quote-unquote savings scored at the national level. What does that translate to for our local healthcare delivery system is an extraordinary loss of revenue for care that is provided to individuals in our community, including one of our most significant sources of Medi-Cal-related revenues, which is our capitation payments that we get for taking care of Medi-Cal members on a per-member, per-month basis. Some of the other significant impacts include what are called directed payments. These are supplemental payments in various programs that have existed to help ensure continued access to services from hospital systems like ours. H.R. 1 immediately froze any increases in those payments, which has some immediate impacts on our organization, and ratchets those down substantially over time to the tune of several $100 million in lost revenue on an annual basis. Another category of significant impact are what are called Medicaid provider taxes, MCO taxes. The voters here in California passed Prop 35 last November, which increased MCO taxes here in California and included some dedicated funding for public hospitals. The Board of Supervisors, the county supported that measure. The voters approved that measure. Unfortunately, H.R. 1 took that off the table, so that measure will not go into effect in California. That's an immediate impact for our county organization in this year's budget. And there's a growing impact over time because one of the other changes that was made in the Senate version of the bill that ultimately became law was a cap and a ratcheting down of the use of that mechanism. And that's a mechanism that's used in different forms in almost all states to help generate the state-related match that's part of how the federal-state Medicaid program is put together. There's a variety of other changes and impacts, but the bottom line is this. Medicaid is the most significant revenue source for our health and hospital system. It's a quarter of the Behavioral Health Services Department's budget. It's a significant revenue source for supportive housing and other critical safety net services. And without that backbone of revenue, the magnitude of impact for our county organization and our ability to deliver those core services is extraordinary. This is the single largest revenue loss for the county organization and therefore the services that we're able to provide to the community since the passage of Proposition 13. Let me take a minute to talk a little about what these services are that we're talking about. Santa Clara Valley Healthcare, as the board knows, operates 4 hospitals and 15 clinics. It's the primary care provider for about 1 in 4 county residents. But more significant than just that, it provides access to care for all 1.9 million residents in Santa Clara County. It's known for excellence in its service. We were really pleased, for instance, just the other day to celebrate at Valley Medical Center its receipt yet again of being named a top 10 rehabilitation center in the United States, best on the West Coast. But that's not unique. That is commonplace in our public health care delivery system that this board and many boards before it, and most importantly, that this community, time and again, has invested in, which is excellence in healthcare delivery and access for each and every resident in our community. SCVH runs 2 of the 3 trauma centers in this county, and we saw the direct impacts during the period of time last year when Regional Medical Center's trauma center was closed. Valley Medical Center had the highest trauma volume in 2024 of any hospital in the state of California. And we operate one of only 3 burn trauma centers between Los Angeles and the Oregon border. These are services that all of our residents, if you travel on 280 or 101, you travel 101 down in the south part of our county where we run the only hospital in that entire geographic region. These are essential services that you never know when you or a loved one will need them, when there may be a house fire or other disaster that occurs. And our system has been there time and again. Collectively, SCVH provides care and is responsible for about half of all emergency department visits in the whole county. It is also the single largest provider of Medicare hospital-based services to residents in our county, a fact that I think many don't know, and a growing piece of service that SCVH provides. There's no way around having such a significant magnitude of impact on the core and most significant revenue source for a system. There's no way around what that could mean for services. And to put that in some context, the operating budget for O'Connor, Regional, and St. Louis hospitals combined is only about $1.3 billion a year. And of course, most of that is backed by revenue. And so that wouldn't be even the net cost. And I just share that because I think it's important. It's hard when you talk about big numbers. It's very hard for us to viscerally understand the magnitude of what we're discussing. The magnitude here is extraordinary. And it's going to call upon this county organization to do extraordinary things, which we've done before in the past, but cannot do alone. And so administration is recommending a multifaceted strategy that relies on multiple pillars, because we cannot resolve a $1 billion plus year revenue loss on one pillar alone. It is going to take a multitude of efforts, and doing so with the speed necessary in order to help mitigate the significant impacts to core and literally life-saving services delivered by SCVH, but also the impacts that would be felt across all of the county's general funded services, public safety, supportive housing, public health, et cetera. Because what this county at its core spends its resources on is the delivery of those kinds of critical safety net services. Those pillars fall into 3 categories, and of course with many strategies within them. One is that we will need to work in deep partnership with the state. Medicaid and SNAP are federal programs that are operated as joint federal-state initiatives. The details of how things are implemented and effectuated are determined by the state government. And there are important, very difficult, don't get me wrong, very difficult, but important choices and decisions that the state is going to have to grapple with on how it responds to H.R. 1 and other related federal impacts. We will need to work in deep partnership with the state to ensure that the 6% of hospitals in California that are public and that provide, those 6% of hospitals provide over 50% of the trauma centers and burn centers and train over 50% of the doctors in California. That backbone for the entire healthcare safety net for all Californians is appropriately recognized as part of the very difficult decisions that the state will have to make. And so our state partnerships and advocacy collectively, falling in a whole variety of areas, not one single thing, is one prong of this strategy of dealing with this extraordinary challenge. The second and largest prong of this strategy, and I want to say largest, is that we will have very difficult decisions and conversations and actions that we will need to take as a county organization in reorganization of services, consolidation of services, reductions, which will require clear prioritization. There is no way around that reality for the county organization in order to ensure that we are doing our part to preserve the most critical services for those most in need in our community. And they will be very difficult actions, but I know from our past history, including even going way back before my time here, the history of this organization in the wake of Prop 13, I know the resilience of the county organization in making it through that. But there is no doubt that the magnitude of those impacts will be significant, will require close and deep collaboration and partnership with our employees across the organization, and will be many orders of magnitude more significant than what we have had to tackle in the last 3 budget cycles, where we've made much more modest reductions. And I share that with candor because the third prong in the strategy is the recommended action in front of the board today, which is to ask our community to provide assistance in the form of a 5/8 cent general sales tax, and I'll talk in a minute about that piece of things. It's always a big deal to ask the community to raise revenue in that way. It would raise about $330 million, which is significant, but obviously a modest piece of what we're staring down. And that's why I say with candor that we are looking, regardless, at very significant impacts on the county organization and the services that we provide and how we provide those services. This third piece, we are constrained in our options. Now, we are very fortunate that pre-existing state legislation gives us the ability to ask voters in this community whether they wish to approve an additional 5/8 cent sales tax. Counties in California don't have any general taxing authority. We are only able to levy the types and amounts of taxes that the legislature authorizes. That's different than for cities. And so, as both a legal and practical matter, the only meaningful revenue option available to us in that vein is a sales tax, and the authorization is up to 5/8 cent So that is where the type of tax and the amount comes from as part of this conversation. It's no magic. It is literally what is available under applicable law. This strategy will help give us a little breathing room. It's a short-term duration proposal that will allow us some opportunities to continue to seek the kinds of transformations that we will need to make in the wake of H.R. 1, as well as continued engagement at the state level and national level, where we certainly hope that there will be a revisiting of what's happened through this national measure. From my perspective, and in looking at the magnitude of what we're facing, looking at all of the different pieces of the puzzle, this ask is one that really is about ensuring continued access to essential and critical services for the community. It's why I make this recommendation to the board to consider this item, knowing that we have mountains to move as a county organization, and in having confidence that our employees and our partners across the county will roll up their sleeves to move those mountains to ensure continued access to health care and social services, behavioral health, and other vital services that are needed for all residents in our community, and so that we can continue to have access to the kind of excellent care for all that is one of the reasons so many of us, my family included, have chosen to make our home here in Santa Clara County, and that makes this place such a special one. It's also a tangible way, a tangible and concrete way for us to say, we will not just sit idly by as the federal government pulls the rug out from critical access to core services, but that we will together and in a multifaceted effort bring the pieces of our community in alignment to ensure that the things that make Santa Clara County special continue. So I'm happy to answer questions from the board, happy to go into further details on the specifics of the proposal, but really wanted to take a few minutes to lay out the magnitude of impact we're facing, the multi-pronged nature of the strategy that we are recommending, and how this concrete recommendation that's before the board today fits into that bigger picture. Thank you.
Well, first of all, thank you, James, for the good presentation explaining why we need to be here. I do plan on actually doing the public comments first, but if there's any preliminary comments anybody wants to make quickly. Supervisor Ellenberg, do you want to say something first?
I would be happy before public comment to make a motion to accept all of the recommendations contained, and then glad to speak more after public comment, please.
Second.
Okay, a motion seconded. Okay, go ahead. All right, let's go ahead and open up the public hearing. So, Rhonda, how many speakers do we have in chamber and on Zoom?
I currently have 20 in chambers and 6 on Zoom. It looks like it's holding at 6. Up, going up.
I'll give it 5, 4, 3, 2, 1. Okay, let's call it. So how many we got total?
All right, so this closes the speaker queue at 29.
29, great. Let's do 1 minute each, please.
All right. Thank you. With that, we're going to start with the in-person speakers first. I'm going to call several at a time, so go ahead and line up, and you can speak in any order. So we have Vivian Lowe, Karen Taylor, Daniel Nelson, Michael Elliott, Karen Steach, and Esmeralda Verilac. Please come forward. Go ahead. No. Go ahead.
My name is Vivian Lowe. I've lived in District 5 for over 40 years. I'm a registered nurse. I've worked in public and private, and recently retired after serving at El Camino Health for over 24 years. I witnessed the level of cooperation during the pandemic as we faced another challenge to healthcare. We now have severe challenges to federal cuts on Medicaid that we've never seen before. It's false to assume that hospitals and citizens in higher economic neighborhoods will not be impacted and will not need to play a role in solutions for crisis that is upon us. We're not a stationary citizenship. We move around. We never know when any of us would need medical care and where we'll be when it happens. When any one hospital is overburdened and has to deny patient access, the burden simply shifts to other hospitals. Time's wasted. So we need to cooperate together.
Thank you very much. And if you have any statements you haven't finished, you could certainly give it to our clerk, and we'll put that to our record as well. Thank you very much.
Hello, my name is Karen Taylor. I'm a native of California. I've been in this county most of my life. I've worked for several of our very big tech giants. I've been in tech over the last 30 years here. I was raised in Santa Clara County when we had cherry orchards, and now we are a mecca for both tech and agriculture. I was actually living in Australia at the time in which this actually happened, but 28 years ago, I actually ended up in Valley Medical. I was in tech. I had a good job. I was working for an amazing company, and I still ended up here. I thought that this hospital was not going to be a place for me. I ended up there 24 weeks pregnant. I ended up delivering twins, both 1.5 pounds. One of them did not survive, but I have a thriving 28-year-old today. But without the services and without the proximity of this institution, Valley Medical, when I needed care and critical service the most, they were there. And that's why we have to continue to help people understand the importance.
Thank you very much.
Hello, good afternoon, Supervisors. My name is Daniel Nelson, and I'm the Chair of Emergency Medicine at Santa Clara Valley Medical Center, and effectively the Enterprise Chair for all emergency departments across our county system. I'm here today in strong support of the proposed sales tax measure to protect and strengthen healthcare in Santa Clara County. Even today, demand for emergency care far exceeds our resources. On average, at Santa Clara Valley Medical Center, we operate at 207% of our ED capacity. And there are times when that number surges to over 500%. Despite these overwhelming challenges, our teams have delivered more care than ever before, dramatically improving outcomes and access. But the reality is we are already operating beyond what the current system can sustain. The federal cuts being proposed would be devastating, pushing an already strained system into outright crisis, not just at Santa Clara Valley, but across all acute care hospitals, emergency departments, behavioral health, maternal care. Every part of our safety net would be impacted, leading to longer waits, worse outcomes, and avoidable loss of life. Thank you.
Thank you, President Lee, members of the board. I'm Michael Elliott. I'm the Executive Director of Valley Health Foundation, and I come here today with two things. The first is my thanks. My thanks for taking decisive action. Just like this county took decisive action to save 3 hospitals, just like this county took decisive action to vaccinate 1.8 million citizens who live here against the COVID-19 virus, I thank you now for taking decisive action against this disastrous federal budget that is going to eviscerate our public health system and put every resident in this community at risk. And the second thing I bring is my commitment. And I know that there are hundreds and thousands of people like me that are going to work hard and fight to protect the health and safety of every resident in this community, and I thank you for leading the way.
Good afternoon, Board. My name is Karen Stake, and I'm the manager of the Critical Care Department at O'Connor Hospital and a proud SEMA member. Every day I witness firsthand the vital role our hospital system plays as a safety net for our community in Santa Clara County. Each of our facilities and service lines plays a critical role in that safety net. At O'Connor, we see over 190 patients in the emergency room every day, perform over 20 surgeries, and care for more than 170 inpatients, all while serving as both a provider of choice and a lifeline for those with nowhere else to go. The substantial cuts to health care in the federal budget are deeply alarming to me and my fellow hospital administrators. These cuts threaten the stability of our entire safety net system. If even one hospital in our network were to close, the impact would be devastating, not just for patients, but for the entire county health system. When our leaders and partners at the national or state level step back, we need to step forward to ensure the safety net remains intact for our community and our patients. SEMA and your county managers support the sales tax and urge you to vote yes. Thank you for your support and leadership.
If we can go ahead and get the next people coming forward, Bob Borenstein, Mark, Rachel Ruiz, Paul Brophy, Praveen Archela, and Priya Pandya Orozco. Go ahead.
Thank you. Good afternoon, supervisors. My name is Esmeralda with Destination Home, and our community, especially those who are unhoused or unstably housed, are asking the same question. What's going to happen to the services we rely on to survive? The proposed federal budget cuts pose a direct threat to the safety net that holds our community together. Losing funding for our local hospitals and the care systems that support more than 10,000 unhoused residents each year will really be risking lives. These federal cuts could force the county to eliminate essential programs across every area that helps stabilize individuals and prevent homelessness even before it starts. We urge you to move forward with the proposed sales tax. We must explore any avenue for protecting these critical services. We do believe this provides an opportunity to blunt the impact of what's coming ahead. Thank you so much.
Bob Brownstein. Imagine if there was a massive earthquake that hit Santa Clara County. We'd all immediately drop whatever we were doing and engage in any action we could think of to rescue and aid our neighbors and vulnerable members of our community. Today we face a fiscal earthquake. It was created not by geologic forces, but by ruthless and heartless ideologues in Washington. But the devastation will be just as horrific, and our response must be just as determined. I urge the board to place this measure on the ballot. Doing so will give us the chance to raise the resources we need to prevent unnecessary injury, illness, disability, and death. In this county, at least, we should stand tall and protect each other. Thank you.
Good afternoon, Board. I'm Mark Herbert, a lifetime District 5 resident. I'm also a member of a San Jose-based food services cooperative. Together with a number of other small county businesses, our goal is to provide locally produced, low-cost nutrition to underserved communities in the county. Recognizing the tremendous importance of protecting local health services, I would ask that the board consider affordability of providing food services, and to the extent possible, create exemptions or create some consideration for food services. Thank you.
Good afternoon, Board. My name is Priya Pandya Orozco. I'm the Director of Infection Control for Santa Clara Valley Health System. Prior to this, I was the Infection Control Manager at O'Connor Hospital. I'd like to take a moment to highlight the critical role O'Connor Hospital has played as a safety net provider to the Santa Clara County community as we face significant proposed healthcare cuts and funding and federal budgets. My colleagues are deeply and I are concerned about the impact that this will have on the integrity of our health safety net system. Each of our facilities lines serve essential, irreplaceable care. To the loss of even one would cause substantial gap in services to those who depend the most on us. At O'Connor, we're committed to excellence in patient safety, quality, and infection prevention, as well as our entire system is. And we have received and garnered 2 national awards that were grand prizes through the APIC, Association of Infection Prevention, and 1 enterprise-wide. During the COVID pandemic, O'Connor led the development of the COVID Tiger Team, the boots-on-the-ground service that were composed of nurses trained as subject matter experts. Thank you.
Good afternoon, Board of Supervisors. My name is Dr. Rachel Reese. I'm chair of Valley Physicians Group. I'm also a pediatric gastroenterologist here at County. I'm a Gilroy native, and I'm a mom of 4. Every day, I care for children who depend on our hospitals, not just for emergencies, but for ongoing care that keeps them healthy. Just yesterday, I diagnosed a teenager with ulcerative colitis, an illness that without treatment can lead to colon cancer in adulthood. And last night, my colleagues in the pediatric intensive care unit cared for a toddler who was airlifted to our level 1 trauma center after being run over by a car. This sales tax measure is a critical investment in our hospitals and clinics, and without it, H.R. 1 will cause devastating gaps in care for our most vulnerable patients, but also the entire community at large. As a doctor, I know what's needed. As a mom, I know what's at stake. We must protect our core and critical services, and this modest tax protects our services. Thank you.
If I can get the next people queued up, Darcy Green, Carmen Martinez, Jack McGovern, Patrick Ahrens, and Allison Brunner. Go ahead.
Thanks. Good afternoon, members of the board. My name is Praveen Anchala, and I'm one of the physicians at Santa Clara Valley Healthcare. With the passage of H.R. 1, the medical community is reeling at the devastating healthcare costs that are headed our way, and the possibility of having to choose who lives and who dies based on a lack of resources. Make no mistake about it, we provide care for the most vulnerable in our population. You've heard that already. But we also provide critical services to the most affluent as well. The changes in H.R. 1 will profoundly impact everybody in this county. Your doctors are ready and waiting in the hospitals 24/7, 365 to take care of you, to support you and the community because we took an oath to our profession, but also because it's the right things to do. My message to the community is this. As you weigh this vote, we want to see, we'll be here to support you as long as we are able in the hospital, but will you be there to support each other? That's what we'd like to see with this vote. Thank you.
Hello, Board of Supervisors, Darcy Green. Do you know how many times since the purchase of Regional Medical Center I have said to patients, to neighbors, to friends and family, how proud I am to live in a county where our leadership consistently does what it takes to defend our safety net and to protect the patients who depend on it. By voting to place this on the ballot, you are not only protecting our county's most vulnerable patients, but you are also defending care for everyone in our county, regardless of where they get their care. That is courage, that is leadership, and more importantly, it is you, our leaders, assuring our community that in the face of these devastating cuts and threats to our lives from the federal government, that we will protect our people and we will keep each other safe. It makes me panic to think about the health and economic impact to our county residents if we do not do this, and understand that this is one of many strategies that the county will need to move forward and lessen the impact and save lives. I support this measure. Thank you.
Good afternoon, Board of Supervisors. My name is Carmen Martinez, and I am the new Director of Organizing with Latinas Contra Cancer. I would like to thank you for being proactive on this pressing issue that affects not one, not 100, but many individuals. While our federal administration strips away our rights to essential medical care and services, we must heavily rely on our community and our leaders to fight back. We cannot sit and wait on the sidelines and hope for a miracle to happen. We need all hands on deck. This tax will be the first step forward in ensuring that no one is denied care. To the community, let's start organizing and make sure that this tax ballot measure passes. Thank you.
Good afternoon, Board. My name is Jack McGovern, Political Director of the South Bay Labor Council, speaking for more than 100,000 union members of the Labor Council today. As the tax from Washington prioritize profits over workers' rights and public services, we must act locally to safeguard what matters most: accessible health care and family-sustaining jobs. This sales tax proposal before you is the surest way to do that. Health care is a worker's right. Our county hospitals and clinics treat everyone, no matter income. Without reliable funding, those doors close for the people who need them most. Second, the measure will protect jobs and public services. More than 20,000 union workers depend on these facilities. Cuts or closures mean layoffs, understaffing, and diminished care. Third, it prevents a privatization crisis. When public dollars dry up, services get outsourced, wages fall, and patient and community outcomes suffer. Every penny raised here will stay here. We, the South Bay Labor Council, are committed to working with you and allies to win voter approval in November 2025. Thank you.
Good afternoon, Board of Supervisors. My name is Patrick Ahrens. I am a state assembly member, proudly representing the heart of Silicon Valley here in Santa Clara County. I just want to echo the comments made by our county executive, and I want to say that the state of California stands with you in hopefully supporting today's action by the Board of Supervisors. We believe it's an important and necessary step to protect our most vulnerable residents. How we need to speak with one voice in one county and doing everything that we can to not leave anyone behind in the devastating cuts that were mentioned. I was born at the county hospital here in Santa Clara County. I would not be in the state legislature if it wasn't for the social safety net services that is provided by the leadership of this board and so many visionary leaders before them. And so I stand with you today in doing everything I can to be supportive of this measure. Thank you.
Real quick, I'll call forward the final in-house speakers. We have Dolores Morales, Kyra Kazinsis, Jeremy Barouse, and Paul Brophy. Go ahead.
Good afternoon. My name is Allison Brunner. I'm the CEO of the Law Foundation of Silicon Valley, a Santa Clara County native and a proud longtime resident of District 5. Wearing both hats, I urge you to vote to approve the proposed temporary sales tax measure for the November ballot. This measure is a vital step to shield our community from the devastating impact of planned federal Medicaid cuts. The county's robust healthcare system isn't just a provider, it's a lifeline. It serves 1 in 4 residents, operates the only hospitals in South County and East Side, and delivers critical services like behavioral health care services. The proposed sales tax is a strategic tool to keep these services alive while we work together to change federal policy. At the Law Foundation, we work with thousands of low-income people every day who depend and rely on these essential services. Without action, these closures will cost lives. This is a moment that demands bold local leadership. I'm grateful that this county is once again stepping up to support this measure. We'll be with you.
Hi, Board. It's Kira Kazanza, CEO of Silicon Valley Council of Nonprofits, representing hundreds of nonprofits throughout Santa Clara County. Just want to make sure you all know that our nonprofit community knows that the community members that we serve will be incredibly harmed by a damaged healthcare system, and that HR presents also a direct threat to the general fund that funds so many of our critical safety net services. And I also wanted to let you know that SVCN will be activating our membership and contributing our financial resources to make sure we push this measure over the line, and we ask kindly for your yes vote on the item.
Good afternoon, Board of Supervisors. My name is Dolores Morales. I'm the proud SEMA president. I'm here today to share with you that I'm also a DAWN member. Recently, DAWN convened a community facilitation made up of South County residents, women, educators, private sector attorneys. They were asked to join us to hear their deepest fears, what's happening at the local level, state level, federal level, and we had over 100 issues brought up. One that was lifted, and that was a priority for all, was how do we fund social services, our network, including healthcare. Today, you have an opportunity to allow our voters to be part of that solution. We hope that you vote yes. Thank you for your support.
Good afternoon, Board of Supervisors. Jeremy Bruce, Director of Policy and Organizing with Amigos de Guadalupe Center for Justice and Empowerment. It's been echoed, the county has a rich history of being a national leader for our most vulnerable populations. Amigos de Guadalupe serves our most vulnerable families with interim housing, rental assistance, and immigration legal services. With everything going on in our community today, immigrant families we work with who are afraid to leave their homes out of fear of being separated, and on top of that, dealing with the food insecurity and the high cost of living, exacerbating issues related to physical and mental health. By putting the sales tax on the ballot today, you'll be sending a message to our families that they are not alone. Thank you for your leadership.
That concludes our in-person speakers. We'll start with our Zoom speakers. Our first speaker is John Sobrato. John, I've asked you to unmute.
John A. Sobrato, the founder and chair emeritus of the Sobrato organization. I fully support the county's ballot measure because it is truly a community-led solution to an urgent problem that impacts all of us. Drastic cuts in federal funding has pushed Santa Clara County into a budget shortfall of more than $1 billion, which will devastate our community's public health system. This sales tax increase amounts to less than a penny per dollar spent, but its impact would be massive. At least $350 million in annual funding to ensure that our critical public health services remain in place.
Thank you. Our next speaker is Dan Stegnick. Dan, we've asked you to unmute. Dan, go ahead. Dan, for some reason, we're unable to hear you. I will come back to you at the end just to try one last time. Our next speaker is Rico Mendez. Rico, we've asked you to unmute.
Thank you, Board of Supervisors. This is Rico Mendez, the proud Chief Elected Officer of SEIU Local 521. I'm here to really speak as the head of the organization, as well as a longtime Santa Clara County resident in the past, and someone that is also the president of the South Bay Labor Council. I couldn't be prouder of this board and our community for standing up for what is right. They are stealing this money. This is the largest transfer of wealth from the rich, from the working class people to the ultra rich, and it's gonna hurt our community. Standing up and doing a measure and trying to find our own revenue that stays right here in Santa Clara County, that keeps our hospitals open, that keeps our vulnerable population supported, that keeps the children fed, is absolutely critical. We are here with this measure. We look forward to moving it, and I applaud you for doing what's right. Thank you.
Thank you. Our next speaker is Marie Bernard. Marie, we've asked you to unmute.
Good afternoon, Supervisors. My name is Marie Bernard. I'm Executive Director at Sunnyvale Community Services. We're one of the 7 emergency assistance network agencies who together cover all the zip codes here in Santa Clara County, and I'm also a resident of District 3. Sunnyvale Community Services is adding our support and endorsement for this proposed sales tax ballot measure. As one of the emergency assistance network agencies, we see firsthand every day how families, low-income families, seniors are struggling to meet their own basic needs. And they'll go without medical care or dental care to pay rent to stay housed. The cuts to Medicaid and other federal programs have already hurt the most in need. The cuts to food stamps, the withholding of food for emergency food and assistance programs are hitting everybody here. We are very, very committed to helping people understand healthcare is a basic human right, and we endorse this. Thank you.
Thank you. Our next speaker is Stan. Stan, we've asked you to unmute.
Yes, my name is Stan Bogosian. I'm a Saratoga resident, a
District 5. I am served in public office in my town, and I am just incredulous that this meeting today is being held in the middle of the afternoon when most people are at work or at meetings. And I'd like to ask that, you know, if you're talking about something as important as a tax revenue measure, that this be offered at a time when folks can actually participate. I have no problem with the advocacy groups that have come forward today, but this is not public participation in the middle of the day. Thank you very much.
Thank you. Our next speaker is Joe Baranowski. Joe, we've asked you to unmute. Joe, we've asked you to unmute. Okay, we'll come back to Joe in a second. Dan, I went on ahead and asked you, oh, looks like Joe may have come on. All right, let's try this again. Dan, go ahead. Can you?
Thanks, Supervisors. Can you hear me?
Yes, we can. Thank you.
Excellent. Thank you. Prop 13 has been around for 46 years, and it's been coincidental with the largest growth in California's insured health care. 46 years, 95% of Californians are insured, and it's disingenuous to hold Prop 13 up as some sort of Roman horse. It would be nice if this did something for healthcare, but it's not dedicated. It can be used for anything. April 8th, the Los Altos Online Crier had an article where half the county's budget was healthcare and $3 billion deficit was what was outstanding. The fiscal year starts October 1 federally. You've had 6 months to get this done, and you're kind of bringing a last-minute, dead of night, 24-hour tax measure here. You can do better, plan better. And venture capital, when people come to us at the last minute and say, we don't have the money, we know they're about to go bankrupt. Thank you.
Our next speaker is Joe Baranowski. We've asked you to unmute.
Good afternoon, Board. Thousands of residents in Morgan Hill, including those in the neighborhood I live, face the reality that if they ever have to dial 911 needing emergency medical assistance, they face the risk that the time for a first response team to arrive will be far below the generally accepted standard if that call is placed during peak traffic hours, which coincides exactly with when the most calls for EMS are placed. If the assistance is for any number of cases, such as cardiac arrest, where the time it takes to get to the emergency care team can determine long-term outcome, including even life and death, residents of Morgan Hill may very well find themselves needing a facility and expert medical personnel the county provides. Even if you somehow ignore the impact on the more vulnerable in our community, it's completely unrealistic to think the massive cuts the county faces will not impact all of us. I support the proposed measure.
Thank you, and that does conclude the speakers who had their hands raised prior to closing the queue.
Thank you very much. Rhonda, I'll go and close the public comment section of this proceeding today, and I will go ahead and turn over to my colleague, since Supervisor Ellenberg, you made the motion. Why don't you go start first on any
Thank you very much,
comments.
and to Vice President Arenas, thank you very much for seconding the motion. I am immensely grateful to the county executive for bringing these action items before us today so that the board can determine how we want to respond to the devastating impacts that will befall our community as a result of Trump's decidedly big but not at all beautiful bill. The first thing I want to make clear is that the implications of this disastrous legislation will not only be felt by people who are eligible for Medicaid or other government assistance, such as nutrition or housing supports. The reality is that every resident in our community will feel the consequences of these devastating federal funding cuts. Let's look first at healthcare. When people lose health insurance coverage, their medical needs don't disappear, and the county's obligation to serve them doesn't disappear. Those costs may shift to those Individuals may shift to emergency rooms and safety net providers, driving up the amount of uncompensated care, which in turn can drive up medical debt and lead healthcare providers to raise prices, not for the uninsured, but for those with private commercial insurance. The result could well be higher premiums, increased costs, and fewer resources for everyone, which would inevitably mean longer waits in emergency rooms and decreased access to care overall. Older adults who depend on Medicare may also see their access diminished, even if their coverage doesn't change. But the damage doesn't stop there. H.R. 1 will require a massive shift in the funding that sustains all our essential safety net services, from nutrition support to behavioral health care, which touches tens of thousands of lives across every income level. If we need to shift general funds from behavioral health care to backfill lost Medi-Cal reimbursements, this potentially puts at risk people experiencing crises and certainly impacts services for people who are experiencing homelessness and exhibiting symptoms of serious mental illness or substance use disorder. This all likely means not only setbacks in our progress to end homelessness, but the real risk of more people losing their housing as a result of catastrophic or unexpected medical bills. Every city in this county will feel these impacts. None of us can afford this situation, and today we quite literally need all 5 of us to lean into our shared responsibility as fiscal stewards and as 5 people who I know genuinely care about the residents of Santa Clara County. We have a unique and weighty opportunity today to ask the voters to determine how we are going to serve our community and meet their needs over the next several years. We cannot afford to sit back and tell ourselves that it won't be that bad, because believe me, it will, for all of us. I take my role in serving the residents of Santa Clara County very seriously, and I know my colleagues do as well. I am deeply, deeply concerned that our county may not be able to provide adequate care and services over the next 5 years without identifying additional revenue, even on a temporary basis. So for that reason, I am eager to support the county executive's recommendation to place a 5-year, 5/8 cent sales tax measure to the special November election. And while no one is excited about new taxes, particularly in this volatile time, my view is that this is a direct and necessary response to the enormous threats to a vast array of county services, both direct and indirect. I look forward to voting yes in a few moments and encourage all of my colleagues to do so as well. Thank you.
Thank you. I see a lights, based on the lights coming on, I have Supervisor Abicoga first. You want to go ahead? Yeah, thank you.
Thank you, President Lee, and thank you for the presentation, and thank you for all who've joined us today. It's a big day. I actually wanted to start off with a question, probably to the county executive. It was mentioned in our public comment that this is actually a general tax. And so when can we expect to establish an expenditure plan for the
Sure, it is a general tax, and obviously the overwhelming magnitude of the cuts that we're facing derive primarily from Medicaid-related impacts that largely hit the health system. There are other impacts as well, and in the materials before the board, we outline the more modest from a fiscal standpoint, but obviously still quite significant from a community standpoint, impacts, for instance, to CalFresh as just one category of example. We will be having difficult conversations already scheduled to begin in the October timeframe here around the upcoming fiscal year's budget process. And given the need for that advanced planning and the fact that even assuming passage of this measure, we are facing very significant budget reductions as an organization. We will need some direction and prioritization from the board as we then engage with departments through that process. So there will be incorporation, obviously, of projections related to this and projections associated with the other impacts, including those not included on the slides today, related to the general fund too.
Okay, great, thank you. So I just wanted to emphasize or just, I guess, yeah, confirm that even with this potential revenue source, we still do face a need to look at cost cutting. I'd like to call it efficiencies and other streamlining strategies, but
We do, and indeed the magnitude of those, just to be clear, and I think it's important for our employees and partners to recognize that the magnitude of those far exceeds the anticipated revenue that this measure would provide, assuming its approval by voters. And there's just no way around that and those numbers, and so that work is going to be difficult, important, and vital for us to engage in.
Great, thank you. And if I may, I'd like to make some comments. Thank you for the answers. So this is definitely a difficult decision. I know that, as we all know, that the federal government has stripped us of $1 billion of county health care funding, and that's what's necessitating us to meet today to discuss this item. I will say that I guess I look at this with a few other lenses. One being that later this afternoon and evening, and Supervisor Arenas and I will be at a VTA board meeting where we will be having to vote to decide whether to opt into a regional transportation measure in November of 2026. And so I don't take this lightly at all. Frankly, I've been working on that for over a year now. So I've seen the dire situation our transportation systems throughout the Bay Area are facing. There are several transit agencies that are facing a fiscal cliff in the next year. And I don't want to get into debates of what's more important. Healthcare is top priority, but then I do have to think about public transit and those who are transit dependent who need public transit to get to their healthcare appointments. So these are all very important to our community. It's just really quite unfortunate that we're in this dire situation. Not that, I haven't been here before, and I hearken back and I use my past experience, my historic experience of being mayor during the 2009, the Great Recession, and facing a time when we had deficits and we had to look at cuts and so forth. So the silver lining to that is that I feel that our community came out of that fairly successfully. And it wasn't without, again, major decisions, cost-cutting measures, and I think, as I've seen various economic cycles, when times are good, and I'd say they have been good in the last several years, sometimes you get a little comfortable. And so as we've gone through the budget process earlier this year, I definitely see that there's opportunity for efficiency. So I don't want us to take our foot off of that pedal. I want us to continue to work on financial prudence and responsibility. So I also have to look at this from the lens of my district, District 5, and how this impacts my district. And there's some unique qualities of District 5. Number one being that there are 9, as I've said many times, 9 out of the 15 cities, and D5, I have the most cities in my district. And the downside to this is that this will take away the city's abilities to raise their own sales tax and, frankly, other measures. And so I have to take that into account. I also wanted, and it was brought up, and I appreciate the public comment, as several members from District 5, yes, the impacts are throughout the county. But when I look at when I look at healthcare, for instance, I have to note that of the 4 hospitals and 15 healthcare clinics, there's actually only 1 clinic in District 5. And so despite 20% of the population being in District 5, we only have 5% of the healthcare facilities. And I think this came up earlier in the year as we talked through the budget. I would really like to see more commitment for the District 5 needs. I think there is this assumption, and some of it is real, that District 5 may have more affluence. But as it was pointed out earlier, the District 5, my residents have needs too. And I would really like to have a stronger recognition of that. And frankly, when I've heard from the community in my district, folks have brought up, other concerns, and whether it's homelessness, public safety, or environmental climate change effects. These are what are important to my district as well. And so as I know, again, this is a general tax, and whether it's to fill this hole, to be able to alleviate some of the general fund subsidy that goes into healthcare at this time, I think we really need to have a serious look at all of that to see how we can provide better services to all of Santa Clara County, including those that may be perceived as not having as much need, because frankly, there is need in my district. So in addition to that, as I think many of you and my colleagues have heard me talk about fiscal prudence and responsibility as we went through the budget, I just want to emphasize the need to take that seriously, to find efficiencies, to streamline our processes. And frankly, what I hear the most from my residents, especially when we talk about tax measures, is they want to see results. And I'm concerned as I've worked on another of these revenue measures. Folks, there's I think some fatigue. We've talked about that, but what I hear most is people want to see results. So we need to commit to producing real results. So in light of that, one of the areas that I would like to offer a friendly amendment to relative to stronger financial practices is that I would like to have a referral to bring back a reserve policy. I talked about this before we went on break when we passed the budget, but our reserve policy is, number one, our reserve is very small. It's really meant to be there for catastrophes like this, and we have nowhere near what we would need to cover a catastrophe. And so what I would like to do is that to offer a friendly amendment, or ask for a friendly amendment, that we bring back the reserve policy in the fall, in October timeframe, to strengthen that, to make it a real reserve.
Actually,
Supervisor, let me ask Tony Lopez, our county council.
I think we're on the same page here, but go ahead first.
Supervisor, that's outside the, excuse me, the scope of the notice to action in this particular meeting. It's something that could certainly be brought forward at a future meeting as a noticed item, but couldn't be made as part of this motion.
So can I make the amendment to bring it back, to bring the policy back?
I think you have the ability to do that as an individual board member at an upcoming meeting. It just can't be part of the motion because there wasn't proper notice given pursuant to the Brown Act.
Let me suggest this. Administration would be happy to include discussion of our reserves in the October conversation, including bringing back some of the materials that we had previously presented, but the board didn't have a full discussion around the reserves that we have. And you're absolutely correct, Supervisor Abacoga, and this is something that I think people don't fully understand and appreciate, that as an organization, we don't have a rainy day reserve. Mm-hmm. It's not been a part of this organization's longstanding fiscal policies. We have some other pieces of things, but not something that's really considered what we would all kind of commonly refer to or think of as a rainy day reserve, and we would be happy to fold that information in, even if it's not part of the actual motion. And I'm saying that publicly, that we will include that in the materials that come in October.
Yeah, if that's the best I can do in terms of a commitment, then yeah, I guess I have to take that. But that's really what I know that it takes I mean, this is very important to me that we make some kind of commitment today to our voters, that we are going to make some significant changes to how we do our finances, and so I really need that commitment here.
You have that commitment from me that we'll bring that material forward in October. If that's what you were looking for additional confirmation on.
Without, can I get some commitment from my colleagues that we will?
I think we were told that that's not appropriate today, but it is certainly something to talk about in the future. And I think it's important to focus this conversation today on everything we're going to do to help, literally to save lives, to help our residents survive this time. And we have had many conversations about reserve policies. There's always opportunity for improvement, and I look forward to revisiting and having that conversation at an appropriate time.
Yeah, so I think I just want to make sure, James, I'm clear what you said about the October, that this item regarding the reserve policy will come back to the board on one of the dates on the October meeting.
Yes, we already have a pre-existing referral to talk about budget priority setting that's already scheduled for October. And what I'm saying publicly is that we will include in that conversation explicitly teeing up addressing the lack of rainy day reserve as an organization as part of that.
Okay, on October. So we will be addressing issues for sure.
And we did share with, I'm now recalling, I think it was only with FGOC, but we shared some research and information on some of our cities. For example, Sunnyvale, for instance, as I think you know,
yes.
President Lee has pretty robust policies in that vein. I know several other jurisdictions do as well. And we actually had done some of that research. And so that's not a new body of work. We can basically bring that material that we had previously done forward. So in that sense, I don't view it as a new category of work for us, because we have already done some of that research, and we can fold that in to the item that will come to the board in October.
Okay, thank you, James.
All right. If that's the best I can get, then I'll accept it. But I very much understand the dire situation, and I know that it's about saving lives. But I guess I look at the way we do our work here and our financial practices as the long-term vision of how we continue to save lives into the future. So that's why it goes hand in hand with me, frankly. And I look at the long-term vision. I've been doing this 19 years, and if we don't have we don't have money to provide services, then we can't provide services. And then I also believe that our taxpayers do have a certain limit, and we can't just continue to keep going back to them. So I appreciate the sentiment. I very much appreciate the sentiment and the compassion of our community. I think that there is quite a bit of support for this. But again, as I've seen this over time and time again, that support seems to wane as we go longer and continue the same practice. So I'm saying, look, we can't do business as usual. We're going to be forced not to do that. But I just want to make good on our residents as well, and try and earn their trust in us. Thank you.
Thank you. The next slide I actually have was Vice President Renz. Do you have something you want to respond to, Supervisor Zonnenberg? Or?
We just wanted to thank Supervisor Abe-Koga for raising these points. This certainly is not business as usual. We have never seen a deficit of this size, so I think it is challenging to think about creating reserves at the same time we're trying to cover $1 billion hole. But in the long term, I absolutely appreciate and hear that and look forward to having the conversation in the fall. It's an important part of our long-term strategy.
If I could respond to that, I appreciate that. I will say, just from experience, that it's actually during these crisis situations when we're frankly forced to change our practices and do something like strengthen a reserve policy, because we learn our lesson that we can't be in this state where we don't have funds right now really to be able to pull from to fill our holes. So it is these times of crises, when the silver lining I've seen is that we come up, we're forced to be better and change our ways to improve. And so that's my expectation here too. Thank you.
Thank you. Vice President Arenas. Thank you.
Thank you. I'm going to begin just by thanking our administration and our county executive for bringing this forward to us. This is an opportune time to bring something to our residents and ask them to consider how to solve this crisis that we're going through together. But we're not asking them to do something that we're not willing to do ourselves, which is to take a look at our own systems, to evaluate, to create efficiencies, and to make sure that we are providing the best kind of service. It's clear in not only in your commitment, but in this memo that you've written out, that this three-pronged approach to not only take a look at our like I said, our own systems and potentially cutting costs by efficiencies or reductions, also looking at outside funding, state funding, other funding that we can potentially leverage, as well as looking at this ballot measure. And if we've been serving for some time as an elected official, we've gone through some crises before. I certainly have, and the first one that I encountered was in 2017 when I first served as a council member, and this is when the floods were happening in the city of San Jose, and people lost their homes, not only their homes, but their memories, the place where they felt safe, their property, and really their stability, and for many years couldn't get back in and replicate the kind of living conditions that they had when they were sharing potentially an apartment with another family. And those are the families that you probably see on the freeways, who we now unfortunately refer to as super commuters, because they've had to live in a different area so that they can afford to continue to be part of our community and keep the jobs that they had, but unfortunately relocate because of something that's outside of their control, which was the floods. And shortly after that, the council asked residents to support a measure, and this was Measure T. It's still in place. It's a public safety and infrastructure, and help with how we respond to crisis and emergencies, our infrastructure. It was really focused on public safety and infrastructure, and we made sure that we had a whole commission, an oversight commission, which is something that I'll be asking the maker of the motion to hopefully include in the direction that we're going to give our administration. And I guess I'll ask for that now. And this is so that the board can create an oversight commission that could help for this funding, that can help continue to build confidence in our community that the funding is being spent as committed. And so that's one of the changes or additions I'd like to make in the motion, if you would.
Supervisor, if I could make a comment. I'm
Sure.
pleased to share that that's already, that's contemplated in the measure itself. And so that is an action that's already embodied in the item that would then be a subsequent action for the board to take to actually create that specific body. But part of the ordinance and the measure does call for some entity like that, with the exact details of its composition and structure to be determined. But
Thank
that
you,
is
and
explicitly as
thank you,
part
and
of it.
forgive me for overlooking that piece. I appreciate that. I wouldn't expect anything less from you, so I appreciate that. The second piece to that would be a financial report that would come back to the board, and I'm hoping that it could be a verbal report that goes between, you know, your verbal report as a county executive and the county council, and the time frame, whether it's on a monthly basis or a quarterly, you know, I can hear from my colleagues to see how often they would like to hear it. It would be great to hear on a continuous basis so that we make sure that we continue to build confidence, like I said, in our community. And that's the other piece I would like to add to the motion.
I think per county council's previous instruction, it's not appropriate to make additions to this motion, but I think, again, the points are really excellent, and we absolutely owe a huge obligation of transparency to the voters. And I wonder if maybe James or Tony could answer this, if at the appropriate time that the expenditure plan is made or we're moving forward, can we talk about that? I think
Because
it's a
I'm not
terrific
asking
idea.
for something separate as a reserve. I'm asking for something that keeps us accountable within what we are doing today.
Correct. So for the, excuse me, because we're not talking about the actual expenditure of funds here, you're actually asking for information about how the funds are being spent or would be spent. If the voters approve it, that would fall within the scope of the notice motion, or the noticed item would be okay to move forward with that as an amendment.
Perfect.
Thank you for making that distinction. With that, I'm delighted.
That would work. Wonderful. And I'll stay in this vein of talking about cuts and reductions. I know that there is already a program, or I can't remember exactly what it is, but it's a feature that we've talked about before, where we get some ideas from our own staff, internal staff, for efficiencies and effectiveness of the services that are being provided. And I wonder if this is something that we can, if it has died, if we can resurrect it, if we can continue to take a look. And this falls within that three-prong approach that you talked about in your memo.
Yeah, absolutely. We have continued to do that, and we have affirmative plans already in that vein, in terms of reaching out and having that be an ongoing process. We've done it the last couple of years as part of the budget process, but flipping that really to be an ongoing process and conversation. So that is something that's already in progress.
Perfect. Thank you. And that would be wonderful to hear about in the report as well, to hear what employees are actually coming up with.
Would be happy to include those kinds of things and updates on what's happening, all as part of the county executive's report. And I've tried to keep the board, as you know, appraised of certainly federal developments as part of those reports. And we were responsive. I think there was it took a couple meetings to show up written on the agenda, but there was a prior request from Supervisor Jung to include some express reference to budget-related updates as part of that report. So I think all these pieces fit together very with a lot of synergy in making front and center the reality that right now for our organization, and more importantly for our community and the services that we provide, that the broader fiscal conversations are really the critical ones, given what we have at stake and the magnitude of what we're facing. So absolutely.
Thank you. This country hasn't always been as in tune and as supportive as our administration locally here is of Black and Brown community and those who sit in poverty for not only currently but in generations. And I know that previously when there was a financial crisis, part of their solution was to repatriate Mexicans even though they were U.S. citizens, folks who had served in wars, who had fought for this country, were repatriated because they were seen as an expense to the community and not as an asset. And so with that, and with a lot of other policies that created inequities for Black and brown communities, especially for the Mexican community, being that this, the border crossed us and not the other way around, is not only just insulting, but it is residual in generations. We see the fallout from a lot of those inequitable policies in our systems today. And we had a Latino health assessment done not too long ago. My colleagues heard some of those results, and I just want to share and remind you that this is what happens when our safety net services are destabilized, or when we aren't cognizant of the kinds of policies that we are enacting to ensure that we have anti-racist policies, to make sure that we don't continue with the ongoing fallout from carrying out some of those past policies. And I'll just share some of what we learned in the past, I think 2 months from the Latino health assessment. And one of those things is that the life expectancy for Latinos is 2 years shorter than the county average. And that 68% of our foster youth kids are Latinos, and Latinos have a twice the rate of child welfare. There's also pieces about how Latinos are utilize 52% of our health system, and are those patients, and 59% of our emergency room patients. All to say that Latinos continue to struggle currently. And when we destabilize our safety net services, we're not destabilizing it for everybody in this county. We're destabilizing it for the people who are already not solid ground. That's what we're doing today, is trying to create more stability, trying to make sure that we create that stable grounding for our communities, so that we are not more harmful to our folks that we know are already struggling. We've seen other bodies do this before, where they have asked residents to tax themselves for the better of all folks. They might not receive the benefit themselves, but what they will see is a healthier, a more vibrant community from all residents that participate, not only in our community, but in our tax base. And I'll say that Latinos, I might have created a perspective or a light of that Latinos are taking from this safety net services, but really it's a correction of generations of righting some of the wrongs from the past, and it takes generations to undo these things. But Latinos also bring so much to this community. They are entrepreneurs. They bring a lot. They pay. They're one of the highest GDP contributors in this country, not only in this county. And so there's a lot of beauty within what Latinos bring to our community, but the reality is that they're also part of the poorest of our residents. And what we need to make sure is that our commitment here is to make sure that we first respond to those who are in most immediate need. It's what even the stewardesses on the plane say is, we have to make sure we help ourselves, and we have to make sure that we are as healthy and as stable as we can, so that we can help other folks. And our system is in trouble, and so we have to make sure that we we help and stabilize our system first, so that we can continue to help those who need it the most. I'll end by saying that it's not only the health and hospital systems that will be destabilized in a time that we know health is so important to so many people throughout our county. But we also need to make sure that people are living a good and stable and vibrant life. And that means making sure that we prevent them from coming into onto the streets and in places where we know are going to create more harm than good. This measure is going to help stabilize not only our health and hospitals, but our children, victims of many different kinds of crimes that we know that happen throughout our county. It is going to do so much more than just address some of the shortfalls of the health and hospital, which I know are a great focus here today. But I know that when we stabilize our health and hospital, we make sure that, like I said, people are healthy, people are doing well, and that translates into the other facets of life. And so I just want to thank everyone for their support today. Obviously, I seconded this, so I'm supportive of the motion on the floor, and I just want to end by thanking all of you who have come today to make an effort to support this measure as well. Thank you.
Thank you. Going back to Supervisor Wikoga.
Thank you, President Lee. I just had a question. I appreciate Vice President Arenas' request and the answer about an oversight committee, but just hoping you can elaborate more as we move into the fall. Like, how are we planning to address our budget issues and challenges? In the past, I've been involved in many ad hoc budget committees. My interest is really that we are transparent and inclusive as much as possible. And I think we do need to be more outward facing. So whether it's through the oversight committee that we include our employee groups, our nonprofit partners, other stakeholders, what is the plan to be as inclusive as we can?
Go ahead, James.
That's precisely a part of what we intend to bring forward in October, is to discuss our recommendations associated with the upcoming fiscal year process. We're really trying to stare down what makes the most sense given the magnitude of impacts that we're facing. And so we'll be bringing forward a series of recommendations related to that. As I've shared with the board previously, the county budget is really a multitude of different budgets. And so there's parts of the organization that are deeply intertwined and interdependent, such as the public safety departments and the health and hospital system. And there's parts of the organization that are fiscally largely independent. So, for example, the most obvious examples being the fire districts and library that are literally separate legal entities, but also departments like roads and parks, or in the case of Department of Child Support Services, is 100% state funded. And the Social Services Agency is our second largest agency, where there is local revenue, but it's all kind of dictated as a match. And so, it's kind of a misnomer to think of the county budget as one budget, and the strategies and issues that affect the different parts of the county organization affect those different sub-budgets, so to speak, in very different ways. What we're staring down here, and I think the conversation that's really at the center of things, is what is the collective impact to that largest swath and category of county services that fall within both the general fund and the hospital system. And that's where, from my perspective, it makes the most sense for there to be specific conversations and different strategies, because there's also a whole series of actions and activities, some of which the board has already begun the process of that impact those as well. So it has to all be kind of put in that context. And I'll just give you one concrete example. The board launched some really important work around the organization and structure of Medi-Cal managed care in our community through its decisive actions in May and June. And that work, which is underway, is one aspect of a set of strategies that impact the health system that were also related to responding to these challenges. So we'll lay all that out when we come before the board. It's part of what I refer to as the need for a multifaceted set of efforts, and it doesn't look uniform across the county organization, which I think is just something that's really important to for everyone, including those who work in our organization and partner with different parts of our organization, to recognize as well.
Great, thank you. And my final comment is just emphasizing, going back, that this is for the entire county, but every part of the county needs to see results. And frankly, I'll say D5 has the highest voter turnout. And so I have to go make a case to my 9 cities and my residents. And part of that is going to be the question of what's in it for me. As altruistic as my residents are, they're going to inevitably ask that question. And so that's why I need to have an answer, and that's what I'm asking for, is support to be able to provide for everyone, including my residents in D5. Thank you.
Okay, yes, Supervisor Young.
Thank you. I just want to thank our administration for bringing this item forward. I want to thank our advocates for coming out here today. And what you didn't just provide incredible public comment, but I heard public comment after public comment pledging commitment, time, labor to see this cross the finish line. It was just less than a year ago that our advocates were also here rallying for Regional Medical Center, because letting Eastside continue to grow without an emergency department, without labor and delivery, without stroke and semi services, without the social services that come along with that, without the behavioral health support and linkage that comes along with that, was unacceptable. And now we're here again, looking to solve and resolve a problem that we did not create. The cruelty of this federal administration, its impacts, will be felt for generations to come. We, as a society, will pay the price for generations to come, not them, us. And so we know that we have to do business differently. I am heartened and encouraged by the conversation amongst my colleagues today, and looking forward and really relying on the conversations that we've had thus far. We will have to do business differently. We will have to learn how to wean ourselves off of federal funding so that our values are never held hostage again, that our efforts to preserve and protect the most vulnerable are never extorted again. We do have to be intentional about reserves as part of that. We do have to prioritize efficiency alongside efficacy. I know that everyone is thinking about that. FGOC will be having a special committee meeting in September just to discuss the impacts of HR 1 amongst the departments that report to FGOC. And that will be where the F and FGOC is finance. It's going to be significant financial discussions, because this impacts everything across our county operation. So I want to thank my board colleagues who have made numerous brave and courageous decisions prior to me joining to save Regional Medical Center, to bring forward the 2016 Measure A housing bond, and yet again having the courage to bring this forward. So I thank you all. As a brand new first time elected, it is an honor to serve on this board and to share and bask in our bravery to face down the tyranny of a federal administration hell-bent on pushing poor people, Black and brown people, off of a health and social financial cliff. I look forward to supporting this. Thank you.
Well, thank you very much, colleagues. Being the board president, I get to speak very last. And as you could hear that many of the comments about this has been spoken, but I just going to go back to what happened just before our recess. On the eve of the passage of the so-called Big Beautiful Bill, we knew that this bill would do devastating cuts to our county budgets nationwide. And we discussed a referral to explore options for generating additional revenues, and we are able to push that forward. Well, at that last meeting, I also mentioned that we have limited capacity to fill the gaps that will be left if Medicaid was drastically cut. $1 trillion Medicaid cut is unprecedented, and it's already here now. This controversial H.R. 1 was passed in July, and now that the rainy day has come, as I said back in June, urgent times requires urgent action. H.R. 1 has punched a huge hole in our safety net. Compared to other levels of government, cities and states, it turns out that counties are disproportionately impacted and most hurt by this H.R. 1 because it specifically targeted cuts to safety net programs that our counties nationwide are charged with providing. Our county operates 4 hospitals and dozens of county clinics, in addition to supporting so many nonprofit community clinics. 1 in 4 residents in Santa Clara County rely on Medicaid, in California being Medi-Cal, and rely on the health system for all their daily care. The Santa Clara Valley Healthcare also provides care to 40% of the Medicare population right here. 53% of the social services agency is actually funded by our federal government to support programs such as CalFresh, SNAP, which is the Supplemental Nutrition Assistance Program, CalWorks, the in-home support services that cares about our family members, child welfare programs and services for people with disabilities, just to mention a few. To be clear, the magnitude of these cuts will impact not just healthcare services, but all the services that the county provides, from healthcare to public safety to homeless services, from Santa Clara Valley Medical Center, the Sheriff's Office, supportive services for the unhoused, probation to the Public Defender's Office, and many more. We will feel the effects of H.R. 1 across the county because of the dramatic reduction in our county resources. If we don't act now, we will have more families going hungry, sick patients going without medical care, and even more sadly, more people will become homeless. We've already cut the fat and will be forced to cut to the bone, and down to the bone marrow if we don't find a way to stop this bleeding. To balance the county budget, we will have to talk about shutting down healthcare clinics or even county hospitals, and we don't want to cut that limb. So for decades, I've never really been a fan of raising sales tax being regressive, but as a county, we really have very few options for generating any additional revenues, like a charter cities would be able to do. But thankfully, back in 2023, SB 335 was signed into law from the legislature that granted the temporary authority to provide the voters of this county the options to raise local sales tax in an amount up to 5/8 cents, which is 0.625%, to support county services. Now, what does that really mean? Well, let's look at other neighboring counties, since I am always a fan of looking at how other counties do things, and if they are doing better things, we should learn. It turns out that the amount of sales tax that goes to the counties directly is extremely low for Santa Clara County, because as of today, we're only getting 1/8 of a cent. So all those 9 and whatever percent you're paying, only 1/8 of a percent comes to us. So if this were to pass, adding this 5/8%. What that means is that it would raise our portion to about 3/4, 0.75% to Santa Clara County. And comparing to a neighboring county, Alameda today already get 1.5%. So assuming you even pass, we will only be getting half the size of that percentage as some of the neighboring counties, like Alameda. And that's why I think it's really the time to use that temporary authority that we got from SB 335 to help stave off these egregious cuts. This measure gives us an opportunity to be on par with some of our neighboring counties, potentially raising this amount, as we said, to this 3/4 cent. Look, we all are hurting from the rising inflation, from our families, and the voters have spoken. But as leaders of this county, it is also our responsibility to do everything in our power to protect our ultimate safety net. So in so many ways, colleagues, we really have no choice but to act now, and we must act boldly and swiftly to save the county from financial ruins. As a matter of fact, I've even heard that some counties are talking about bankruptcy because of HR 1, and we don't ever want to have that discussion. Our 2 million residents are counting on all of us, and we cannot let them down. And I'm very glad to hear from the comments today. It appears that this will likely pass. I really want to thank my colleagues and our county executive and your team for bringing this very important issue up in such short order. However, the hard part moving forward will be having to explain and educate our voters on why this is important in order to earn their trust of us to support this important measure to save our county. And I hope everybody in attendance today who spoke in support of this will need all your help to come forward. Thank you very much. And without further comments, let's go take the vote, Rhonda.
Supervisor Abekoga?
Aye.
Supervisor Yoon?
Yes.
Supervisor Ellenberg?
Yes.
Vice President Arenas?
Yes.
President Lee?
Aye.
Motion carries unanimously.
Well, thank you very much for the unanimous vote, and I hope, as I said earlier, there's a lot of hard work ahead to get this to the voters by November 4th. And just for point of clarification, Tony, our county council, this will be on our ballot on November 4th, am I correct?
That's correct.
Right, and this
November
will be
4th, 2025,
2025,
special election.
and this will also be on the same time when we are going to be looking at the replacement of our county assessor as well, correct?
That's correct.
All right, good. Well, thank you very much, everybody. Now the meeting is adjourned, and our next board meeting, which is our regular meeting, will be next Tuesday, August 12th at 9:30, same channel, same location. I just want to say thank you to the clerk of our board, staff, administration, and security, and we'll see you soon right here in Chambers. Thank you very much.